Health, they say, is wealth. Solid public health base is one of the key signs of good governance. To this end, governments spare no effort in promoting public health, which has to do with the science of protecting and improving the health of the people in their communities by detecting, preventing, and responding to infectious diseases, among others. The Yahaya Bello administration in Kogi State in the last few years has underlined its determination to provide quality health care for the people of the state. By renovating or building new specialist hospitals across the state, including the Prince Abubakar Audu University Teaching Hospital, Ayingba, the Specialist Hospital in Lokoja, GYB Specialist Hospital Isolu, GYB Specialist Hospital Egain, General Hospital Ida, and the Specialist Hospital Tego. However, the reference hospital in Okene ticks all the boxes. It is without a shadow of a doubt one of the legacy projects of Yahaya Bello administration, one which is meant to address the issue of medical tourism, which costs Nigerians about 664 billion every year. Okene Reference Hospital is also meant to serve as teaching hospital to the Confluence University of Science and Technology, a specialized university established just before the end of Governor Yahaya Bello's first term in office. I had heard of Okene Reference Hospital and seen beautiful pictures of it in the online media, so I decided to travel to Okene to see things for myself. Located on the site of the old Okene General Hospital, the reference hospital boasts of a giant standalone building where all its wards are located. I was met on arrival at the hospital by Engineer Kabir Suleiman, state consultant, who handled the project. He spoke about how long it took to put the project to bed, as well as some state-of-the-art equipment installed therein.
Right behind us here, you can see the Okene Reference Hospital, 100% completed, fully furnished, fully equipped.
Tell us some of those things.
It has CCTV everywhere. Everywhere you are in this hospital, you are seeing somewhere. Somebody is somewhere watching everything that happens, both in and outside. Every action that happens in and outside the hospital complex. Then it has an internet facility which is meant to help the doctor to make research while they discharge their duty as medical doctors here, when it becomes functional as reference hospital, as it is called. As it is now, you can see it is 100% completed. The only place we have some little work going on now is on the doctor's quarters that was recently, commissioned. So very soon it's going to be completed. By the end of next month, we will have it fully completed and furnished.
He also described how challenging it was to work on the project and meet the governor's expectations.
It was a tug of war. That is why it is good sometimes when you have people of our age supervising projects like this. We can give it everything we have. We give it all of us to get it done. We are not scared of anything because we have the power, we have the energy. I left here around 11 p.m. yesterday night. This morning I was called that we have to be here, and I'm here since morning. So any day, any time, we are always ready to move. You know. So it's been serious tug of war, but to the glory of God, we've gotten it done, and we give all glory to God.
Inside the building, the State Commissioner for Health, Dr. Zachary Usman, was waiting to show me around the inner recesses of the hospital, beginning with the dialysis unit.
So the dialysis, consumes a lot of water, and it's not just water, but water that has large molecules and ions separated. So there's what we call a technology known as reverse osmosis that treats that water specially for the nation. The general source of water for the hospital, is different from this.
Okay.
And the water.
It's a different kind of water.
It's the same water, but it has to be treated, separately with the reverse osmosis machine.
Mammography unit.
This is a 3D, a three-dimensional mammograph, and it's a sonograph precision machine. This is what the latest technology, that is. Yes, latest. Exactly.
I had the privilege of seeing the maternity ward and the labor theater. Premature births, babies born more than 3 weeks before their estimated due date, stand a good chance of surviving, given the quality equipment here.
Women that are 10 means that the pregnancy has come to a point where they should be delivered. Yes. Naturally, every woman's aspiration is to deliver via what we call spontaneous vaginal delivery. But because it's not always like that, because of a number of factors, some of them have what we call critical obstetric height. Some of them, the baby is bigger than the pelvis. There are so many reasons. Some of them have had CS before. So because of that, when they come here and the labor seems to be delayed for any reason, or there is no indication for even normal labor, they actually go into the labor room theater. This is the labor room theater. On this monitor, most of the procedures that are going on here can actually be seen there. Yes. Even if the patient wants to be part of the process, because they can actually give an epidural anesthesia that she's not put to sleep completely. You can at the gas point where that's what I was asking you to. The other thing is the phototherapy machine. You know, when a child is delivered, some of them come out with jaundice. So they are put under a regulated, light, and that light will help. What causes jaundice? Bilirubin accumulation. So depending on which one, if it's the one that is amenable to the use of this, the babies will go through here, and then the jaundice will clear. This is second in the world, first in Africa. And some of the features are because of the helium usage. The other machines can actually utilize about 2,000 liters of helium, but this one just about 900.
During a conference call with the manufacturers of the Signal Prime MRI equipment, the makers confirmed that the MRI machine installed at the reference hospital Okene is the first of its kind to be installed in sub-Saharan Africa.
His Excellency Yahaya Bello has been very ambitious and very decisive in equipping this hospital. So when I told you that this is the best hospital in Nigeria, in Africa, most have not been to other parts of Africa, it could as well be the best in Africa, I was not mentioning words. This here is a Revolution Magma CT scan machine, 128 slides, top-notch, high-tech equipment, cutting-edge technology, betting here, just like the MRI machine.
From the radiography unit, we move to the game-changing oxygen production unit.
This place is the medical oxygen plant. Medical oxygen because oxygen is available in the atmosphere, but it has to actually be converted to medical oxygen before it can be used. Now this plant is a plant that helps us to generate our own medical oxygen. Yes. And if you look at it, this starting from here, this is the entire contraption that makes the plant. I may not be able to give you specific engineering breakdown, but what this plant does is to generate oxygen for use, medical oxygen. And medical oxygen has been classified even by WHO as an essential medicine because it's life-saving. Yes. And what happens here is, if these machines have been installed, they have been tested, and they are functional. As a matter of fact, they have even used them to fill some cylinders in this place. At full functioning capacity, this equipment can actually generate between 140 to 150 kg cylinders of oxygen per day. All you need to do is, at least when it is powered, it is allowed to run between 6 to 10 hours before you begin to use it. So on a very good day, between 7 to 10 cylinders per hour, and between 140 to 150 kg cylinders per day. What it means is that we can actually generate the oxygen for consumption more beyond the need that we have in this state. So we are also creating a niche. We're creating opportunities for Kogi State is in the center of this country. We're bordered by about 10 states. And from the last time I've checked, none of these states have an oxygen producing plant.
Wow.
So, all your neighbors. Yes. Kwara doesn't have, Benue doesn't have, Niger doesn't have, don't know of anyone in the FCT. So the fact is that by the time this facility becomes very functional, it will not only providing Medicare for the people from here, while not only reversing medical tourism, we're also providing opportunity. Everybody can come here to buy, medical oxygen from us.
Dr. Zachary told me how proud he was to be the Commissioner for Health in Kogi State at this time. He said any commissioner for health in the world would like to have the kind of equipment the Okene Hospital and others have. He is immensely grateful to the Kogi governor for his decisive intervention in the Kogi State health sector.
How I feel is indescribable. But all I can say is that I think I'm having the best of my life and best of time so far, because any commissioner anywhere in the world will be glad to have these things happen during his time as Commissioner for Health. And I am excited, at the prospect of what this portends for our country, Nigeria. I'm very, 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 very happy, and always, at all times, grateful to His Excellency for the opportunity that he has given me this time, and to have this happen, during my tenure as a Commissioner. Like you say, this is just the biggest of them all. But there are about 6 other newer hospitals that have sprung up across the 3 senatorial zones in this country, in this state. Many of them also equipped with latest technology. Who wouldn't be happy? So I think it's the best of time for our people of Kogi State. It's the best of time for people of Nigeria, because this is going to be put to use, and this has been a decisive effort. It's not something that is not a knee-jerk reaction. I'm sure if you see the quality of work that has gone around, and I don't know if you've gone around other facilities, but if you see the quality of work, if you see the state of the equipment, you will know that this is a decisive action. This is a deliberate action. And His Excellency has always said, this will solve 3 things. One of them is to bring healthcare to the doorstep of the people. Best healthcare that can be gotten anywhere in the world. Second is to create an avenue for us to have the capacity and the human resource to be able to intervene. And
The Yahaya Bello University trained medical doctor and public health expert with an impressive private sector background also told me that the specialist hospital in Lokoja is 96% completed.
With specialist hospital in Lokoja, it's almost, let me say, just to be conservative, I would say that we're about 96%, ready to go. I'm sure you saw the magnificent administrative block, the new one. I'm sure that you saw the fantastic re-engineering that has happened in that hospital. You've seen the delivery of all the equipment. So I think all that is left is just finishing touches, the aesthetics, and putting the machines where they should be. Otherwise, we're almost there, 95%. If you look at where we were and where we are now, it looks almost like a new hospital was built in that place.
From the Okene Reference Hospital, I took a short trip to Okpogoro, located just after Agasa, the hometown of the governor, where one of the governor's foot soldiers, Ahmed Usman Ododo, has contributed his own quota to healthcare delivery in Kogi State by building a hospital named after the governor's mother, Yahaya Bello. Still tracking facilities put in place for effective healthcare delivery in Kogi State by the administration of Governor Yahaya Bello. I am currently in Okpogoro village, and there is a facility here delivered by one of the governor's foot soldiers, Alhaji Ahmed Usman Ododo, and it is named after the governor's mother, Yahaya Bello. Right here we have facilities in place that can ensure that cases that do not need to be referred to tertiary medical centers can actually be handled here. So for residents in the governor's hometown of Agasa and Okpogoro, this facility has been provided to take care of their healthcare needs. To say that Kogi State is in a good place health-wise is to say the obvious. Yet, Governor Yahaya Bello says there is a lot more to expect from him. Babajide Kolade Otitoju, Okpogoro, Kogi State.